Welcome to this episode of Evidence of Greatness. And I'm really excited actually about this article. The article that we're going to be considering today is called Now I Am Myself, Exploring How People with Aphasia Experienced Solution-Focused Brief Therapy Within the SOFIA Trial. So I just want to give you a little bit of background. The SOFIA trial is happening in the United Kingdom, and you can see the authors who wrote this article: Northcott, Simpson, Thomas, Barnard, Burns, Hirani, and Hilari. And one of the things I think that's really valuable about this concept is people with aphasia have language difficulties. And so oftentimes we as solution-focused practitioners, we get the question of, does this approach work with people who struggle in, insert many different ways? And one of the things that we say all the time is solution-focused brief therapy is a language-based approach. And so as long as people can engage in a conversation, they can participate in this kind of work. So then this article came through, and there are a couple of others that are related to this, so you should look them up as well. But this article came through, and it talks about people who struggle with language. And so I think it's important for us to consider in a language-based approach, does this work? So we're going to walk through a little bit about this. The first thing that we need to do is talk about what is aphasia. And aphasia is a language disability that affects things like speaking, understanding, reading, and writing. So obviously it's affecting language ability, right? And one of the things that the authors of this study talk about is people who manage life with aphasia, it can disrupt their personal identity, right? It's, as you think about going through life as someone who does not struggle with language or language abilities, then all of a sudden most often this will occur when someone has a stroke. And so it changes the way that I perceive myself. It changes the way that other people may perceive me. I can't string words together or formulate words very well. And so that disrupts who I think I am as a person. In addition, it changes life plans, what I think I'm capable of, right? Potentially, if you think about going on for school or a career, if I'm unable to speak or understand or read or write, that may change the trajectory of my life. Also, aphasia has been linked to challenges within social networks, oftentimes leads to fewer friends or fewer social activities because I withdraw. I don't feel like I can communicate very effectively, and therefore I withdraw from my social interactions with other people. In addition, around 30% of people who have had a stroke experience aphasia. So this is something that is quite common for people. And we need to really think about, could solution-focused brief therapy be an effective avenue for helping to treat people who are managing aphasia? So that obviously begs the next question of why should we even consider aphasia within a solution-focused brief therapy context? And the authors of the study give a couple of really important considerations. One, they say it's not really understood or explored how people who have acquired communication disabilities experience psychological interventions. And you think about it, oftentimes they may exclude themselves from psychotherapy because they feel like, I'm not able to speak or communicate well, or perhaps they think that the therapist might not be able to understand them. And so they might then not engage. So we don't know much about how psychotherapy is effective or ineffective with people who are dealing with these kinds of disabilities. In addition, the authors comment that people with language disabilities are often left out of receiving mental health interventions. So it's not just that they're withdrawing or not choosing not to attend, but psychotherapists choose to exclude them, especially in research, because they think that they can't communicate well enough to participate or answer the questions or those kinds of things. And so they eliminate them or exclude them from possible research. So this is kind of a groundbreaking research study to say, what happens when we actually provide this population with psychotherapy? Do they use it well? Can they understand it well? Can they participate? Can they benefit from this process? And so then they consider specifically within an SFBT perspective. And one of the things that they argue is the SFBT might be a uniquely good fit for people dealing with aphasia because SFBT focuses on people's resources and their expertise rather than focusing on their deficits, right? Think about even the concept of aphasia. They have a disability. There's a deficit in their ability to communicate. And solution-focused brief therapy is going to focus not on the deficit, but on their resources and their expertise and what they can accomplish and maintain. In addition, the authors cite this meta-analysis. It was done in medical settings. So this is solution-focused brief therapy within medical settings. And this study was conducted by Zhang and his colleagues. And in this meta-analysis where solution focus was used in medical settings, one of the things that they found is that overall, there was a significant effect that solution-focused brief therapy had on health-related psychosocial outcomes. And you can see the statistics there. It's a statistically significant finding. And what that means is that solution-focused brief therapy is effective and produces positive outcomes within medical settings. And so they're saying, if that's true, it should apply to people dealing with aphasia after strokes or the other kinds of things. Within that meta-analysis, there was one study that was considered, and that study said that there was preliminary research that showed that patients who experienced a stroke who received 10 solution-focused sessions shortly after they were discharged from the hospital experienced significant benefits in terms of mood and lower anxiety. And so within that meta-analysis, they're saying stroke patients specifically within medical settings benefited greatly. And so I think that's one of the things that we need to consider is oftentimes people say, does this approach work with insert problem? And aphasia or people managing strokes or medical conditions might be a population where people would say, you know what, I don't know if solution-focused brief therapy can work with them. And in this preliminary data that the authors of this study cited, they show that there was a positive impact. So there is some preliminary evidence to say people who are dealing with these kinds of things can benefit from this kind of intervention. So now we get to this particular study and the methods that are used in this particular study. So this is a qualitative study. And like I mentioned before, they also did a quantitative part and they published that in a different article. But I think this article is really useful for us. So they did qualitative interviews with people who had received 6 solution-focused brief therapy sessions. Now, this group of people, they were part of a larger study. So this larger study was a randomized study where they put people into 2 groups, one where they got solution-focused brief therapy right away, and the other group was a waitlist group, and then they had the option of receiving solution-focused brief therapy at the end of it. So if you want to know what the outcomes were of that randomized trial, you should look at their other article. But these interviews then happened after both groups got the solution-focused intervention. Most of the interviews took place in the client's home. There were a couple that happened at a university clinic. The interviews occurred depending on which group in that other study these participants were placed in. So there was one group that treatment group that got the solution-focused work right away, and they received these qualitative interviews about 6 months after receiving the sessions. So they got these interviews about 6 months after. The waitlist group, they got the interviews 9 months after the randomization waitlist period, which then resulted in shortly after receiving the solution-focused sessions, they participated in these interviews. So it's interesting because the interviews happened at different times, but then they collated the results together. So all of the interviews were conducted by 3 different interviewers, and all of those interviewers were experienced speech and language therapists. So the other thing that is important is that the people who did the solution focused sessions, they were also speech and language therapists. And so they had a combination of speech and language skills, and they had solution focused skills. So I think that's something really important to note. But these clinicians who did the therapy, they received 6 days of solution focused brief therapy training. They received regular supervision throughout the course of these sessions. They received real-time support if they needed it, and they based their work on a treatment manual. So all of that is to say the methodology for this study is actually quite sound. And I think that's important because that's then lends itself to say that these findings we can put a little bit of trust in because the methodology is sound. So they did mention that they had to do a few adaptations to the solution-focused work. And these adaptations weren't changes to the theory or the way that it was applied, but it was adaptations because of the population they were working with, people who are struggling with language. So here are some of the adaptations they made. Therapists used what they call total communication strategies. This drew on the person with aphasia's communication strengths. So things like writing keywords down, using gestures when they asked questions, allowing people to draw pictures, or they as therapists drawing pictures, using pictures or images that were like photos or things like that. And they also used objects within the environment. They were also really conscientious to simplify questions, to support abstract concepts with visual images. They used scaling questions, but often if they used scaling questions, they supplemented them with pictures. And then they celebrated recent successes through the use of photos. So you can see that a lot of the concepts are consistent across, but a lot of the adaptations they used were to allow people to point or to show images or those kinds of things. The conceptualization of aphasia that they also wanted to take note of is that they saw these people as oftentimes there was a grief reaction happening. And so they were transitioning into a new identity, which we kind of highlighted and talked about previously. So that's some key information that will help us understand how this solution-focused therapy actually occurred. So then the participants, who were these people that participated? Again, they were all people who were diagnosed with aphasia post-stroke, and there are 2 different kinds of strokes, the ischemic or the hemorrhagic strokes. The stroke occurred at least 6 months ago. All of these individuals were adults, and all of them had aphasia based on assessment. There were 30 total participants for the study. 16 of them were women, 14 of them were men. All of them had the option of choosing whether they wanted to have 6 sessions. They could use between 1 to 6. Everyone chose 6 except for 1, and that person chose to use 5 of the sessions. 73% of the people who participated were white. 16% were diagnosed with mild to moderate aphasia, and 14 of them were considered severely aphasic. And this study, again, was conducted in London. So the procedures that took place for this study, the topics that were covered in the interviews, they wanted to make sure that they understood how the participants experienced receiving solution-focused brief therapy. They wanted to give people an option to talk about the observations that they had around the logistics, the amount of therapy they had, what ending therapy was like. And then they also wanted to talk about if change occurred during their therapeutic process. And then the data analysis section, they talked about how they used a framework method, which was a thematic analysis. They discussed those themes that were developed as a research team, and then they went back through and recoded things to fit all the content within those themes. So, so that's kind of the information that was how they got the information. So then the results, they kind of came up with 2 major themes. And the first theme was the value that they placed on the therapeutic components. So one of the things I think that's really, really important is that these people, these 30 individuals who participated, they strongly endorsed that the conversations were suitable for people with aphasia, even severe aphasia. So all of them strongly supported this approach was a useful approach for people who were struggling with language difficulties. Then sub-themes within this category is they said one of the reasons that they felt like it was suitable is that they really noticed accomplishments and they spent time discussing their accomplishments and the progress they were making. Second, they talked about how thinking about future hopes was sometimes useful, was useful to these people. Think about much of this idea was they were developing a new identity. And so thinking about their own identity and where they would like to be in the future was something that many of them mentioned as being useful. Interestingly, many times they linked doing things outside of therapy that they had mentioned that they were going to do inside of therapy. And so it almost became like, if I mentioned it in therapy, I then had the motivation or I had accountability that I would then go out and do some of those things outside of therapy, even though the therapist didn't say, go do those things now. So they mentioned that there were therapeutic impacts outside of the therapy room. The third thing that they mentioned was explaining their feelings and their experiences of going through this process was helpful. They felt understood by their therapist, and they said in some sense, some of them said, I didn't want to talk about the problem. And this approach made that an option. Other people said talking about the approach or talking about the problem was actually useful, and spending some time and having my therapist allow me to talk about that was a useful experience. The fourth thing that they mentioned is that having companionship and a timeout from their problem was useful. So they felt included and they felt like their therapists were patient with them and they allowed them time to formulate the things that they needed to say, even though it would take some difficulty. And just talking to somebody allowed them to feel understood and to feel valued. And then the last thing, which I think is really important, is the relationship they had with their therapist. Most of them said the therapy relationship that I had was one of the things that I really, really valued. And so as you look at that list of things that people who with aphasia mentioned, those things, if you just took out the aphasia, right, and you put in any other reason that somebody might come to therapy, those things would really hold true. Noticing accomplishments, thinking about what I want for the future, letting somebody know what my feeling and my experience is, having an opportunity to step away from my problem, being able to relate with my therapist in a meaningful way. And so although these are the findings from people who are dealing with aphasia, I could easily see these things being the component that people might mention if they were coming for many other reasons. The second result that they talked about is perceptions around progress. And this is a really interesting thing. Many of the participants didn't talk about therapy leading to change. And you think about that, right? Their ability to formulate language or to utilize language, it might not change. They might be in a steady state. And so many of them talked about the companionship and feeling noticed and feeling valued was actually more important than talking about change per se. They used words like feeling reinforced, feeling mended, feeling like there was a connection, feeling improved or uplifted. So one of the things that I think is a takeaway from this process is if we simply talk to people on a human level, if we talk to them about their hopes, if we talk to them about the things they would like to see in their future, there's a valuing there, there's a reinforcement that's there, and we should make sure that we don't lose that. In addition, it's important to note there was a subset of people who said, I was hoping that going to therapy would impact my aphasia, that it would change my ability, that I would get better. And they were disappointed that in some instances that didn't happen, which again, I think is valuable for us as clinicians to understand. why are people coming to therapy? What is their best hopes? And if their best hopes is change the world around me or change my my particular experience, that's probably outside of our realm. It's outside of what we have control over. And so really nuancing our questions and really understanding how we can connect with people around what they're hoping to achieve is really, really important. The sub-themes that came out of this perceptions around progress, they're listed on the right side here. So they talked about their mood and their identity. Many of them talked about feeling better, looking forward, having more self-respect. Again, there were a small subset of people that said, I don't feel better. But they also didn't say I feel worse, right? And this is that subset of people that were saying, I wish it had changed my aphasia in some way. Another sub-theme in this category was communication. Most of them talked about having an increased confidence to speak, which I think is really, really valuable, because some of them would say, my ability to speak or my capability to communicate didn't change, but my confidence about speaking did change. And I think that's one of the things that's really valuable about solution-focused brief therapy, is that we're talking to a version of somebody who is confident. Despite the difficulty that they're having, if there was a confident version of them that showed up, what would be different? And so you can see that we're impacting the way they viewed themselves without necessarily changing their capabilities. They also talked about having increased positive relationships, more independence, more mobility, and more willing to participate. And so in essence, they're saying things changed. This therapeutic approach really did positively impact me. Now, I think that connected to this idea, there's another thing that we need to consider. And this idea, it's about change. Does therapy lead to change? And they broke down the group of 30 people into 4 subgroups. And they said there was one group that changed, and they said that there was a meaningful impact. And this was about 11 of the 30, so about 1/3. And most of the people in the group began their experience with low mood. So they started and they were kind of in a depressed state. They had low mood. And they talked about how this therapy, solution-focused brief therapy, changed their mood for the better. They felt more hopeful. They felt more optimistic. They, again, felt more confident to speak. And so there was a change for them. There was a second group of people, another 10 people, so again, another 1/3 of people, who felt like connection was much more important than change. They felt like connection and companionship is what was really impactful. So change wasn't their focus. They didn't start with low mood, but they did feel isolated at the beginning. And so just being with another person, being with a therapist who was compassionate and understanding, that was helpful enough to them. So they weren't necessarily looking for change, but they were looking for connection and companionship, and solution-focused brief therapy provided that. A third group of people talked about it was a kind of complementing an upward trajectory. They started therapy in an okay place and in kind of a positive, optimistic place. And therapy was one part that contributed to improvements for this group. So as part of this process, beyond just getting therapy, they had physical therapy, they had occupational therapy, they had other things going on for them. And they said this was one component that was really helpful amongst a series of things that were helpful. And then the fourth group was this discordant group, and we kind of touched base on them a little bit before, and they were dissatisfied with the focus of therapy. They felt warm about the therapy. They thought the therapy was, helpful, but they didn't find it very useful to them because it was inconsistent with what they wanted to focus on. These are the people who said, I wanted my aphasia to get better. So going potentially to speech therapy, that would have been more useful to me. So they didn't enter into the therapeutic process looking for help emotionally or connecting or those kinds of things. And therefore they said, it was nice, but it wasn't actually what I wanted. And I think that that's a remnant of the research, not necessarily the remnant of solution-focused brief therapy. And so overall, you see 25 out of the 30 people said, this was useful to me. I felt like it was really helpful. And the other 5, they didn't say it wasn't helpful. They just said, it's not what I was looking for. And so by and large, this group of people was saying, even though I had language difficulties and this approach is a language-based approach, it was still very helpful to me. And then here's the final official source for this article. So one of the things that I want to point out is that oftentimes we might assume that this approach wouldn't be useful for people who struggle with language difficulties. But you just heard in their own words, they said, actually, this was very useful for me. It helped me to get better. It helped me to feel connected. It helped me to have more confidence. It helped me to feel more self-respect. And so I think that's one of the things that we need to make sure that we remember is that this approach doesn't necessarily help in the way that we imagine that it would, but it is useful to people. And we need to trust in the process that solution-focused brief therapy can be useful with a variety of presenting problems, even aphasia. So thank you for being here. Thank you for spending time with me. Thank you for considering the evidence of solution-focused brief therapy. If you have other articles or suggestions about things that we should consider in evidence of greatness, please let me know. I would be happy to hear your suggestions. But in the meantime, go out there and do great work. And remember, the presenting problem doesn't really matter. These kinds of conversations and meaningful connections are what help people to feel like this is a useful approach.